that's the thing we really wanted to frame this conversation around, was that of college and career readiness. A few years ago, in 2009, 2010 time period, Kentucky, we did education reform. Back in 1990, we did CARA, which was, back then, if you remember the early CARA, like people like burned couches in the streets, and teachers retired in mass numbers, and so we overhauled the complete system again. We just called it Senate Bill 1. We didn't call it education reform. We kind of cut back on the revolt. But it's put a lot on schools, and it has really changed our education model. And so, but the gist of that is this notion of college and career readiness, and really what are students able to do, what are the skill sets, what are the 21st century learning things that we built into that educational process. And so for us, it really has been a way to engage, and we'll talk about some of our barriers, and lack of policies and lack of requirements for health education, physical education, school health in our state, but also some of the ways we built that into that piece. I think when we look at that, that's the reason I'm really hopeful about the Kentucky Health Now plan. It's really connecting state agencies, really sending the consistent messages about what we need to do, because no matter how successful we are with the Affordable Care Act, no matter how successful we are with Common Core, if we don't change the long-term health outcomes of our students and our citizens, then that's always going to impact our economic development and our future. And so when we got CEOs that are looking at investing in the state, all those health outcomes that we know where we rank, 45th, 49th, whatever those different measures are, we have to change those, because that's a growing healthcare and different things. And so that's kind of where we want to frame that message of why health has to be the foundation of college and career readiness outcomes, because no matter how smart we make students, if they're not living long and being healthy and reducing chronic disease, those are the things that are impacting every single one of us and continue the climate race that we can continue to afford to deal with. So we're going to do a little activity to start with. So I'm going to ask everybody to go ahead and stand up, because we know that you don't learn best sitting on your seats. We're not going to run the 10-miler. I think that's tomorrow. You want to run the 10-miler? You can talk to people about signing up for that tomorrow. Everybody come over towards the center a little bit.
Huddle up.
So just huddle up here in the middle.
Good.
Don't have to be real tight. Just over
We'll
to the
get
middle.
warmer. They promised to fix the air, so.
So as we're climbing, we're boarding our ship. You guys recognize the ship? All right, you're getting a little nervous? Yes? All right. So what do we know about this ship?
It's gonna sink.
Biggest, best unsinkable ship, right? Unsinkable. If I need a captain, somebody can be our captain. Somebody volunteer to be the captain?
Looks like Captain.
We can change the outcome. It doesn't have to. All right. So we can all take the captain's lens for just a second. What are we worried about when we look out as captain of this ship?
Iceberg.
What? Yeah. Well, so what do we see? What are we looking at?
Water.
Looking at the ocean. What happens to this ship?
Thanks.
Did they see the iceberg? Oftentimes, when you think about it, like people like see the iceberg. Really, you don't see the iceberg. The iceberg's below the surface, and so oftentimes, that's what my experience has been in this state. Is we look at the surface and what we see, and we say, "Oh, well, look at all these different things." So that's where I want to kind of frame our conversation around what really needs to happen. It's not the things we know we see on the surface; it's what's below the surface that's really going to be detrimental. And when you think about the U.S., and you think about our economy, a lot of times we call ourselves an unsinkable country. But if we don't change some of the things that we're doing, we're going to be as vulnerable as the Titanic was with some of these things. So you guys may go back to your seats. I didn't wait or anything. On this one. The next one will be more vigorous, I promise. And so we frame it like this with this analogy. The Titanic in the modern day U.S. As a nation, and as a state more so, we always invest more in treatment than prevention. That has to change. That has to change in order for us to have the outcomes we want. And this is the reason the Institute of Medicine recommends to strengthen schools as the heart of health. And I think that's kind of where we're at right now as a society, as a culture. And I think some of the work that we're doing that I'm really excited about. Because I think a number of years ago, we started doing some things with schools, and schools have been resistant to say, because for a while, it was almost schools were getting the finger pointed at. Like, you're doing this, and you're doing this, and it's all your fault. But in reality, we know it's multifaceted as far as what issues are in our schools, as well as with our communities and different things. But David Baird, I always like to share, this was David's quote that he said, and it's really, really stuck with me. And he's a Kentucky School Board Association. We hosted a symposium with them. And he was talking about the roles that schools can play. And he said this, he said, when we look at our country and how we treat people with gender equality, schools didn't cause that issue. But schools were the entity in our culture that changed that norm. When we look at gender equality, when we look at racial equality, when we look at disabilities, schools didn't cause those issues. But schools were the commonality in all societies and all communities that said this is the way we behave, this is the way we conduct ourselves. And I think that's the reason schools are such an important element to where we're at with healthcare right now, is that schools didn't cause those issues, but if schools are not the ones being the messenger to send that consistency, and so we have a lot of room to do to improve in schools, but also we have to be that messenger to our communities. And because schools are in every sector of our state and of our nation, that's the reason it's a good place to start. And so that's the reason we're really excited about some of the things. And so as we think about that iceberg analogy a little bit, here's what is really frustrating to me as a personal health advocate, is I see conversations in legislature year after year after year. Let's find money to do treatment for heart disease because that's going up. Let's find more money to treat stroke. Let's find more money to treat type 2 diabetes. Let's find more money to treat cancer. We have all these big money budget items that we continue to fund over and over and over again. But at what point do we stop and go, why as a state do we have these issues so much more than other states? And that's where we get to looking at what's below the issue. What are the issues below the surface that really need to be addressed? And so we'll kind of cover some of those things in Kentucky and where we need to go from here, and looking at that investment and looking at how we, the educational system and the role that schools play in that and what below the surface. Because we know that we have minimal policies in a lot of these areas. A lot of focus on English and math and reading, and that's great. But at the same time, if we don't start focusing on that consistent messages, if schools are not that messenger with those things that lurk below the surface, we're never going to change it. We can't get enough. I always say this analogy. It's always like we're always trying to find more water for the fire. Instead of thinking, why is there so much fuel on this fire? And when you change the fuel, that's when you change the outcomes. And that's really where we look at some of the things we want to do with coordinated school health in Kentucky. Back over to the power. And so we kind of, this is kind of, we backed up. We're looking at college career readiness from 30,000-foot view, and kind of these, the relationship between these health, education, and poverty. And it's this cycle. And this is really the cycle we have to break, because we know the connection between lower education attainment, or greater health disparities, poverty plays into that, and so this cycle. And so that's the reason it's so imperative that when we think about college and career readiness, we really have to make sure that school health outcomes are part of that, because that really is the key to our future here in the state. Now, Vicki made fun of me for being a PE teacher, but I will tell you, this next slide is one that is a prized possession of mine. This technology that it took me to do this, I'm making it a lot bigger than it is. But so when we talk about college career readiness, our message that we always say is that coordinated school health is that missing link. Ready? There you go.
Animation.
Pretty good for a PE teacher right there. But that's kind of the message. We talk with school boards associations, school administrators a lot, and talk about those outcomes and different things. So we'll do an activity that kind of tie in that how coordinated school health is that missing link and what that means.
And just to continue on, all aware of in your packet, or you picked up Help Your Students Are Better Learners by Dr. Charles Bass, which is Journal of School Health. In the last couple of years, we've just given you the summary. It's 100 pages or so, real in-depth information. But what we pulled out for you all up on the screen are some of the notes in terms of health-related problems play a major role in limiting motivation and ability to learn. And Dr. Bash focuses in 7 different areas of health disparity. Goes in on physical activity and breakfast. So what we will be focusing on, not only in our grant, but in our talk today. Which you can see vision, asthma, teen pregnancy, depression and violence, and activity ways of so he developed this. It really at how it is that we and it goes back to we take a look, see of how do these items look in Kentucky. Is the Youth Risk Behavior Survey. This is a survey done every odd year in the state of Kentucky. It's run through CDC. Stephanie Bungie is our coordinator at the state level for that. And with that, we are able to have state level data that shows in terms of the areas that we just showed you, Dr. Bash. So this is the high school level. We do a high school survey. We also do a middle school survey. We do a middle school survey. We feel like things, behaviors don't just automatically start as a ninth grader. Got some years into that. So we want to have a more look-see at the middle school level in terms of so we do middle school and high school. And with this one specifically at high school, we've combined this with academics. So the columns relate to, in the blue, it means the physical fight, and in the blue, you made A's. It was 19%. Red is if you made B, 26% in a fight. You can see as you make C's, it's 40%. That's 43%. I've asked for better data in terms of kind of what's going on with health behavior, as well as where people are achieving academically. Happy with what's going on. We also gave you guys a booklet right there that gives you kind of a little snippet. Well, that's okay. I knew you hid it from me. You did that on purpose. But with that, they'll give you some middle school data. It just gives you a little look-see and we really call to look at this information, to go to education's website and check it out. And it's relevant for your area. Yeah, but you can see all across the board how different things are occurring, and the more likely you are to engage in a risk behavior or making lesser in the grade.
Mentioned things that lurk below the surface. So look at it from a big picture, especially around physical education and physical activity. Here's of Kentucky's profile. The only requirement is a half credit graduation, education as well as physical education. You paint the big picture. What's that mean for elementary PE? We're one of 7 states that does not have an elementary PE requirement. If you look at the chronic, call it the Bible Belt, but if you look at the chronic disease obesity belt, we're the only state in the Southeast U.S. that does not have an elementary PE requirement. One of 10 states nationally that does not have a middle school. In addition, there is no physical activity requirements at any grade level. A number of years ago, there was Senate Bill 172. The 172 allows 30 minutes a day to count as instructional time, but it does not require that of schools. So when it comes to PE and PA, that is completely a site-based and local school board decision-making process. So all 173 districts and all 1,200 plus schools, they determine how much instruction. Oftentimes, because of funding and different things, these are the programs that we see cut and reduced and eliminated. And so when we think about what we see on the surface, we understand why when a kid enters kindergarten in the state of Kentucky next to 12th grade, you can count very easily the amount of minutes of instruction they're going to receive in 13 years in school, compared to a lot of other subjects that are getting a lot of face time year in and year out. So we've got to think about that and really look at that, because I think when we look at the scope of that, that really has impacted a lot of the outcomes that we see. If you flip the equation around, I told you that's how much reading instruction students we're going to get. What are you going to say? You have an illiteracy problem, right? Well, we have a chronic disease issue because we're not infusing those skills and we're not allowing for adequate time. So we really got to think what are the ways that we can prioritize those for schools. And funding has to be at the core of that. Because when you look at what happens at the state level, unfunded mandates never get passed, especially when it comes to and health and different things. Really got to look at that holistically as a state. So with the Kentucky Health Now plan, optimistic. At least there's conversations occurring from the governor's office. Vicki and I had an opportunity, our first time in our work, to sit down with the lieutenant governor this week and talk to him about the Health Now initiatives and what we see in Kentucky. program review, but it's also a way to share disinformation. Sometimes decision makers don't understand the simplicity of what schools lack. And so at least we have that awareness that's starting to be generated a little bit more.
Okay, what's the good news? We've set the stage in terms of what's occurring in the good news is, at that quadrant, that was funded, basic funding level to all 50 states. So we had a coordinated school health grant for a few cycles now. It was always with education. Directly funded education and paid for a position. Now things have switched in terms of how CDC is looking at things, and they did a reorganization in all the things that are going on with health, with chronic diseases, and everybody together and try to have more synergy. So that's where we get into the 4 areas that we cover: mental health, diabetes, heart disease, as well as obesity. That Kentucky was able to apply for enhanced. I had the opportunity to pay for the grant writing, so we're really thankful that we got also the enhanced funding. So you can see the dollar amounts that we received. That is split in a percentage. That's why you see Jamie and I here, as we're part of this.
I will say that for most other states, this completely decimated their school health funding. Because the money in the original coordinated school health money that came from CDC, it went to state departments of education. We've had a lot of cross-agency stuff that goes on. Vicki and I, we have a great working relationship. We also have a state health subcommittee that Susan mentioned. Dr. White, who's principal investigator on this grant, serves on our health subcommittee, and so that cross-agency has really provided a nice conduit for that conversation. Now that all the money goes to public health under this funding, and Department of Education is now a contract for public health. And so that's our role. We look at all of our colleagues in other states that have been through this CDC training and through this CDC funding. A lot of them lost jobs in this process because a lot of that money stayed at the Department for Public Health. And so we really do have something to build upon, because the other thing, big picture with this grant funding, is states had to show 25% match in state funds. So when we look at those 4 program areas, I can tell you the other thing that really it was eye-opening, we had a really, really hard time finding 25% match. That's across all of our state agencies. And so when we look at health outcomes, we have a lot more money coming from CDC to invest in our state than we do at the state level when it comes to the state health department and state department of education.
Because matching funds can't be federal funds. Dr. White is our deputy. Talking about that Susan served. And at Public Health, we have always been really excited and very of education and what education does and value that. Had a long-standing relationship that kind of put us up above. I would bet that we will be the rock star state in health and what we're able to do because of this relationship and because together to work to really improve health measures. That's what we're going to begin to get into. Us to focus in on nutrition, activity, as well as staff wellness. And with that, you'll see I've highlighted in here, it's looking at the school level. It's that received PD and technical assistance strategies for a healthy school nutrition environment, and then it's for students. Staff have been trained specifically on creating a healthy environment as it relates to nutrition. We'll be doing a lot of different work as it relates to technical assistance and training. Yesterday, thinking about what kind of summer training in nutrition as well as physical activity. Physical education and physical activity performance measures. Here, the 2 beginning ones look similar to the last 2. The technical assistance level, it's at the student level in terms of the policies. The bottom 2 talk about state level measures. And these are areas that we will be working with the Board of Education Health Subcommittee on, as well as our administration, grassroots level. In terms of, we would love to see some type of activity activity policy for school, all been adopted by the state, as well as about recess. Talk to you a little bit more in depth about what is a comprehensive activity policy. It's got 5 components to it, but I won't steal Jamie's time. And then work sites. We had a choice as a state of how are we going to look at it. And because we have such a great relationship with education, we said, hey, schools are funded all across. They are the largest employer in many of our counties. So what better way to work on school staff wellness than in our schools? So with that, it'll be the number of work sites for us at schools that adopt strategies to increase physical activity, and then the number of employees working sites that have adopted that strategy.
Everybody stand up. And what you need to do on the back, if you have another sheet of paper, that's fine, but I know that this sheet has at least a blank side on the back. So go ahead and stand up for this activity and find a blank sheet of paper or use the back of one of those, doesn't matter which one. And draw a circle on the back of a big circle, big circle, like a plate. Drawing a plate. So here's what I need you to do. We're going to take on 3 different roles for this activity. If your birth month ends in Y, you're going to be an administrator. Okay? If your birth month ends in Y, you're an administrator. If your birth month ends in R, you're going to be a PE or health teacher in the school, or another school health related person. If your birth month doesn't end in Y or R, you're going to be a who you are? Read those because I can't remember which way we did it. Pick one of those 3 of it. Whether you don't know what month you're born in. So what I need you to do is write down, as you're standing, some working activity, stand up, write down what is on your plate in that role. So what do you think's on that person's plate? If you're the PE teacher, what's on your plate daily, weekly? What's the big things you're held accountable for? If you're an administrator, what's on your plate? What are the 3 to 5 things that you're held most accountable for that you deal with day in, day out on a weekly basis? If you're a classroom teacher, what's the main things on your plate? What to do day in and day out. All right, looks like everybody's got at least a couple written down. All right, where's my administrators? Raise your hand if you were the building administrator, school administrator. Name me some things on your plate.
Teachers' professional development competency.
All right, professional development competencies, budget, what else?
Test results.
Test results, academic achievement, big one. Anything else? Staffing, okay. Parents, attendance, discipline, security. All right. If you're the health or PE teacher or the school health person, what's on your plate?
I see working with the other goals of the other academic areas, supporting them.
Okay. Other things, what's on your plate? Lesson plans. Yep, lesson plans, assessments. Must meet the state standards. All right, absolutely. If you're a classroom teacher, what's on your plate?
Best
All right.
performance.
Performance. All right, good.
Facilities, safety.
So, you have 3 different audiences we just discussed: an administrator, a classroom teacher, and a school health champion, PE teacher, health teacher, school nurse, somebody like that. Those plates sound different. Schools, so when we talk about the school health person, we can find the champions in the building. We can find the people that are passionate about it. But the reality is, what's on my plate as that champion or that champion's plate is very different than that administrator's usually. So what we got to do is really think about how do we mold our message, where we're not putting something else on schools' plates, because that's what they consistently hear over and over and over again. I don't need something else on my plate. So when we looked at what the goals of this grant were, nutrition environment, PA policy, staff wellness, we had to be very careful in whatever we designed to put out to this state as expectations, that it wasn't perceived as, oh, here comes something else on our plate. So we had to make sure that we were cognitive of the 3 plates, or, you can look at a lot more plates in the building, but holistically, we had to think about, we need to make sure whatever we do, whatever our strategy is, that we make sure that we tell our audiences clearly, we're not adding something else to your plate. We're going to take what's on your plate and help you do it better. Okay? And so that's kind of what we'll share with you a little bit as we look at what we're specifically doing within this new grant. You may have a seat. We always like to practice what we preach, so getting self, we know that sitting for more than 20, 30 minutes at a time, that's not the best learning. Over and over again, we see classrooms struggle with that because we want to do things traditionally, and so engaging the brain is always what we try to do. Simple things like that. It didn't take away from instructional time. It didn't take away from this presentation. It actually helps to enhance it. So what's our plan? So this is what we've developed in Kentucky for the next 5 years of this grant to implement. It's what we're calling the Kentucky S.H.A.P.E network. S.H.A.P.E is an acronym that stands for School Health and Physical Education. Very simple. Bad news for us on this, we really liked the name. It was simple, it was concise. This is what we're going to do to engage coordinated school health around the state. This was our Kentuckyizing of a coordinated school health model around the 8 components. The downside is our national organization used to be the American Alliance of Health, Physical Education, Recreation, and Dance, AFER, what we refer to it as. Well, they realized that name was working real well, and so they renamed the national organization S.H.A.P.E. We already had our stuff done, we already had it branded or whatever, but so there in our field, there is some teachers talking about being S.H.A.P.E. And at our national organization. Voted no, but I was the only one voting. But we had it before they did. And of course, we got our little apple and heart there, and that's health and academic goes together. So that's our approach to Kentucky. Our state association is not changing its name, so it will remain the Kentucky Association. I did vote on that board. Won't have that confusion. So what is the S.H.A.P.E network? What we looked at is the Department of Education has been wildly successful in Common Core implementation. And we've gotten a lot of notices and a lot of recognition from around the nation on Common Core implementation. The way the department did that is they made sure they had specialists in all 8 education co-ops. And so we wanted to kind of replicate that model. And so this is kind of holistically how the education co-ops look. This map is a whole lot prettier because different co-ops offer different services, but ideally it's regionally located just like that. And so what we're doing this year into year 2 is we're going to begin by working in 4 of the co-ops. GRADD is one of the co-ops that we're getting ready to engage in this conversation with because we're just not hitting implementation. But we're also working over in the light blue, dark blue area. Obviously, we have a lot of high disparate areas over there as far as health outcomes. We'll be working in eastern, southeastern Kentucky. And then OVEC, which is up the Ohio River corridor there above Louisville to Orange. So the orange, green, blue, and purple. Now, we can work with any district or school directly. So if somebody calls and says, we want to do a curriculum training or we want to do this, we have internal capacity to do a lot of different training. So we can work with anybody in the state if they're willing to put the buy-in to allow us to come and bring the people to the table that we would request. But holistically, we're going to do a lot of targeted trainings in these 4 additional ones. Our plan, of course, we're not working with the money that they got in Common Core. So we don't have a full-time specialist that's going to be working. But what we will do is stipend a teacher to be that content lead in that region to engage more schools in the activities we're about to share. So we will eventually have a cadre of 16 trainers per co-op. This first year we'll have 8, because we'll have an elementary person in each co-op and a middle school, high school person. And that'll really be the person that kind of conduct the professional learning, connecting successes, and really learning from each other about what successful implementation pieces are going on, and really just to kind of beef up that professional learning concept and learning from each other.
If your school system has already adopted a coordinated.
Awesome. Yeah. I'll give it into the specifics of what we want to do within the S.H.A.P.E and how that is complementary to things that may already be existing. Okay. And so when we looked at it, we were very cognitive of what I said earlier. We realized there's a lot on schools' plates. And so we want to make sure whatever strategies we do to engage these co-ops, these trainings and professional developments, we want it to be to think about what's on that plate. And so one of the things we know is on that plate is school accountability. For health and BE areas, it's what they call program review. We know that schools are working through those measures and looking at school health, looking at wellness policies, looking at comprehensive school physical activity, looking at the assessments. We know that teacher effective. There's all these acronyms in education that schools are inundated with right now with the continuing instructional improvement system, and there's all these different resources there. So we want to make sure everything we do within this SH.A.P.E network approach is connecting schools back to those things that KDE loves and cares about. And so that's really what we've looked. And so we realized there was 2 existing partnerships we already had that were occurring. One was the Alliance for Healthier Generation. The other was one that had rolled out the previous year, Humana Vitality. And so with both of those organizations, that's really what we're looking at, how to engage schools. Both of those we're able to engage and get a lot of data back from those. The Alliance, for instance, has the Healthy Schools program. I know that Davies County is engaged, and I think there's a couple more. J.C. Woolley is West Kentucky rep for that. And so we've done a lot of partnership with that. And the reason why we work with the Alliance so closely is their program is based on nutrition as homes. So we looked at the outcomes of our grants. There's no need to recreate the wheel to give schools a program when we already had measures. And in fact, we've had so much existing relationship going on with them, we'd already done a complete alignment document. So we actually have an alignment crosswalk that shows here's everything your school's held accountable for in program review. Here's everything that the Alliance for Healthier Generation program will help your school to identify evidence in around that. And I think it was 2 years ago or something, I met with Davies County, and when JC was engaging some schools down here, and that's the exact conversation we had. We're not putting something else on your plate. Here's what your schools are already held accountable for. Here's what they're looking at, and here's how this helps to do that. Another good thing about that is because the Alliance it's a free program for any school in the nation. If you work with a relationship manager, they'll come and give you more direct technical assistance, and you got to have someone in your district involved. But it's free for anybody, and so it's a free resource. It's data driven. For a long time, we didn't have good data coming from schools. The old CDC tools that we had, that the foundation done a lot of stuff with the School Health Index. Those are great tools if your people have all the time to commit to them. Most of our champions, most of our school people, they got a very small window, and so it needs to be clear, it needs to be concise, and it needs to be friendly. From a state perspective, we also need data back from it. So when schools were utilizing some of those CDC tools, we didn't have a way to say, hey, guess what Kentucky's doing? We didn't know. Because you do it on paper, you do it in a local office, unless you send it somewhere. And so everything we're trying to build in now is making those data-driven decisions. And so we're working with the Department of Public Health and Education to sign an intermediary agreement with the Alliance so that we have continual data that we can pull from schools and really start to paint that advocacy picture for what's going on in actual school buildings, where in the past we didn't have that capacity to do that. Humana Vitality, Vicki's going to talk a little bit more about that one in just a second, but with Humana, last year was the first year they rolled out the Vitality program. So previous Humana had done the Virgin Health Miles, it was kilometer-based. Last year was a voluntary year for Humana Vitality. And then, of course, this year with the Employers Health Program, it was the Living Well Promise. This was really, really a big key to that. 80% of all state employees enrolled in Humana Vitality, or will be enrolled in Humana Vitality through the Living Well Promise. And so,
Let's say the reason school employees receive Vitality or Humana. But with that, they don't have to take it, say, if their partner, et cetera, is taking another one, but you're going to have 80% more school employees. So with that, Humana Vitality, started a couple of years ago. It's just really kind of getting its roots going. You're going to have data for us. At Public Health, we always get really excited about data. You don't know how many epidemiologists I have the opportunity. A lot of them. And so with that, we'll be able to get data. They're going to be able to get school district data. We were saying to Humana Vitality, hey, we want to work together. We want to work on this, but we really want to know what school districts look like. Well, with our help and our push, they're going to be able to now look at school districts. What is going on and see what employees are Vitality program. I don't know, is anybody here involved in Humana? Couple people? Okay, so you all understand in terms of that this year, there were like 4 plans. Some of them were a wellness plan. 80% of folks chose one of the 2 wellness with that. You could do the Humana Vitality with that. So you also have to do a health risk assessment. So we'll be moralities. We're not going to know specifically, John Doe did fine. So we'll be taking a full look see at what's occurring there and how people are participating in this school wellness. And with that, you also can do different trackings. You can do different ways to improve health. They have goals set up. They have just a whole program of working more with Humana Vitality. They have regional folks, and I don't know if you all know that, but if you all are interested in one area, they could talk to you more about Humana Vitality. We partner with them. Service Center. Already in the school system, they do some things, and they help the school staff. They develop their own little kit promoting a school staff wellness program for that. So now we are moving forward and we're looking as other folks that might work in an after school for a long period of time with kids, with a bunch of kids. Our program, Humana Vitality, is open to the points. Humana Vitality, you earn points. Points equals dollars in the mall or something like that. So you can get an Amazon card. Which their teachers, as well as maybe through the after-school program. A teacher or the after-school program would get points for having led their class through some type of physical activity. This is kind of an evolving event. So with that, we're forward to being able to roll that out hopefully this fall as an opportunity for a lot of kids in Indiana.
Yeah, and like I said, we kind of found the need, and we'll kind of get in that. Kind of help the teachers. Well, if you're depending on PE alone, as a classroom, honest, helping them with what's there. That's the reason we see the Humana Vitality is such a asking teachers to do more, a lot of ways to give them programs and get them engaged in them. So here's another thing that we did that we've been working on and developing. You have this sheet that we passed out to you. So to really take this down to the nuts and bolts of what it means at the school level. So once again, this comes back to that plate thinking, what's on their plate. So we know there's 2 things to build upon. First thing we know in Kentucky, now I mentioned a lot of things we do not have. Here's what we do have. We do know that all 173 school districts have a district wellness policy. I guarantee you that, promise you that. Why do I know that with such confidence? Because it's federally required in order to get national school breakfast, school lunch reimbursement. SDA. So in 2010, the Child Nutrition Reauthorization Act was authorized. And that was the Healthy Hunger Free Kid Act. So there are 3 phases of that federal act. The first one was the school meal pattern. That happened in year 1. So the amount of soda, the amount of calories that were served in school meals, and that's the one that you still hear a lot of press about people complaining, kids are this, and you're changing eating patterns, and so you have a lot of people that are talking about that, and unfortunately I think it's always the negative things that seem to be the loudest as far as the outcomes of things. But that's been evolving, and districts have been engaged in that. The second phase of the Healthy Hunger Free Kid Act was this competitive foods. Ironically, Kentucky had very strong competitive food things, and so with some of those, it didn't change us a lot. We already had restrictions on vending machines, things that were allowed to happen so many minutes after the first school lunch or the last school lunch was served. So competitive foods was the second phase. The third phase is the wellness policy, and that's really where we're at right now. It was just announced, and it's in open right now as far as those requirements, but we know there's 4 overarching goals that they want to do to improve wellness policy. The problem they seen on the national level was the same thing we experienced here in Kentucky. One person knew about the wellness policy, the health teacher didn't know about it, the PE teacher didn't know about it, the principal didn't know about it, but local school board passed the policy and that was over and done with and nobody ever looked at it. Now, that didn't always happen in every district, but a lot of places that was the case. And I worked with my PE teachers all the time in our state association. Most of them didn't know there was a wellness policy in their district. So obviously policy is not what you say, but what you do. And so engaging stakeholders is a key part of that. And so that's what we know is happening, involving stakeholders. So we've outlined these things and we've Kentuckyized it. So here's the federal piece and we're going to tie it into program review. So how does the state requirements meet the federal requirements? So involving stakeholders. We want the food service director. We also want the school nurses. We want the health teacher, the PE teacher, the counselor. We want a collective group just like this, talking, discussing what is it we're saying and what is it we're doing. Second part is setting specific goals for nutrition education, nutrition promotion, and for physical activity. This is very critical because I told you school boards play a big part of how much PE and PA goes on in schools. Making sure that you have the people, the awareness that are brought to local school boards, so setting goals around what we can be doing. Measuring implementation, making sure it's not just a stagnant policy. This is a living, breathing document. Here's what we said, here's what we passed, here's what we're doing. Every school board is required annually to give a report to their local board. Having people, having parents engaged in that process is very critical, and that way we're looking at what we're actually doing to measure. And the fourth one is one that Kentucky's done for a while, but we want to improve that, and that's publicly reporting implementation and progress. Being transparent, letting parents know, letting community know, letting newspapers know, here's where we're at, here's what we've done, here's what we've accomplished, here's where we're going to grow at. And so making it a collective process at the district level. And so that's the kind of the federal piece. And so, and you can read this a little more in depth on this sheet as far as what it looks like in each of those steps. But we're very specific in doing and creating this. And so this is really what we said. There's coordinated school health exists at two levels. You have a district responsibility at the district level, and that's the top box of this darker box. And the second one is what really happens and where the rubber meets the road in the school level. And so how are these processes complementary with program review? And so there you see the roles that are identified at the district level. So annually reviewing and updating, just making sure that each school has a committee. That's where the Alliance for Healthier Generation comes in place and helps you create that wellness committee at the local school level. Ensuring that all schools are implementing the policy via a school policy. That's another element that's in program review. Know that districts have a policy. We know that some schools may or may not have a policy at the school level. We make sure that's implemented, and so having a local school policy in each individual building about how you're doing those things. Why is that important? When you look at diversity of schools, different schools are going to engage and implement things different ways. A great example is classroom parties. It doesn't really work always real well to have that in your district one because that doesn't really apply to your high school and your middle schools. And other elementary schools may want to do it differently. Your recess pieces may be a little bit different at each school as far as what works best for that building. Having a local school wellness policy is very important, and that's the reason in program review, in order to be proficient, schools must provide evidence of how they're doing that, how they're engaging their district policy and implementing at the school level. And so these are all things that we identified that the district council can do at each school district, and then ultimately what it looks like at the individual school. That's how the roles of the school committee come into place with the school improvement plans, providing the district council feedback. And we're actually working to we kind of see the flow of program review to district wellness to school wellness policy and letting schools know this is how we're engaging. This is what the S.H.A.P.E network is really working to change that conversation around. We recently had a state school health summit back in December. Big deal, talk about that in just a second. This is the exact process that anytime I get an opportunity to come and meet with a local school board or school district, this is the conversation I'm having. Because I'm making sure I'm not here to put something else on your plate. These are the things that are already on your plate. Let's make these things work together. Let's make them flow together. And that way we see implementation. But not only we see implementation, we see stability. That's really we always highlight this one because I told you that districts have to do an annual report. And some of those reports have been very generic and vague. We haven't created a system where we gave schools great data. Some school districts have done a really good job. In Fayette County, we worked, Merit was actually on a cadre we did with the National School Boards Association. We focused on this process right here. And Fayette County had two people on there. Dr. Shelton was on there, as well as Amanda Ferguson, a local board member. And that was a conversation that we really opened up with them. They'd been doing these reports and posting them online, And you can actually go to their website, Fayette County, and look back and see in 08, 09 how generic their reports are. Last year, what they gave to their school board was this nice colored report. It was kind of an overview of everything going on in their district. They talked about Fuel Up to Play. They talked about Action for Healthy Kids, Alliance for Healthy Generation. But you get about 3 pages in that report, it actually gives you school by school by school data. Do they have a committee? Have they engaged in this program? Have they done that? And so when that came to the local school board, now they're able to make an informed decision. Now I have some real data from every single school in my district, and now I can really see what's actually going on instead of just some generic, yes, we do this, or no, we do that, and there's 5 or 6 questions. And so really giving districts, school boards, the opportunity to really make data-informed decisions. And so that's really what we're looking at now, is how to make that tool available, or a tool, a database, where local districts can replicate that process. Questions on that? All right. So you've heard us mention this a couple times, and this is kind of an area that we've been very successful in the last couple of years, and there's a reason why. So this concept of comprehensive school physical activity. Now, I got to tell you, I've been at the state for 3.5 years. I was a PE advocate. I love what I do, believe in what I do. When I graduated from college, my first school teaching at, kids need more PE, kids need more PE. How many people believe that? Kids need more PE? Yeah, I was like, yeah, more PE, give kids more PE. My principal came in and said, all right, we'll give you more PE. Showed up the next day, I had 50 kids in my class. Yay, kids get more PE. Crap. Quality and quantity are 2 different things. Yeah, they were in my gym more. 50 kids in a class versus 25 kids in a class. And that's the reality, and I think that's kind of where our profession is nationally. We beat on that PE drum so long that if somebody actually said, yeah, we wouldn't know what to do with it if we got it. And so funding's an issue, facilities are an issue, and so when we look at that, yeah, we need to maximize PE. Yes, we need to give kids more PE opportunities. Yes, we need to invest in quality physical education, but daily PE is not a reality in most schools. You have 700, 800, or 1,000 kids in a school. That takes a lot of facilities in order to adequately do physical education. So a couple years ago, we were working, and that's the reason this concept became embedded in program review. Because when I talked to our associate commissioner at the time, we were talking about childhood obesity. And why do we want data? In Kentucky, we know we're 3rd in the nation, or we're 5th in the nation. We're somewhere where we don't want to be in the nation as far as childhood obesity. And she looked at me and said, well, what do we need to do to fix it? A lot of things I could have said. I would have loved to have said daily PE. I also know the states that have done PE requirements don't always get great implementation, or they get implementation and then kids are not getting quality instruction. And so I said, I think we need to put it in schools' hands, site-based council's hands. We need to put it in school board members' hands and say, let's do it from a comprehensive approach. Physical education is the cornerstone of every school building. The skills, the knowledge, the attitudes that they learn in PE about being physically active, about that value, they're not going to learn anywhere else. But there are other opportunities in that school environment to engage kids to be more physically active. There are things that classroom teachers can do to get kids up and teach content, but at the same time get kids active and moving. Brain research shows over and over again that's a great way to implement differentiated learning. We can also look at what can we do to supply schools, to support schools before and after school. Where the bell rings. After the bell rings. Kids are there. What are ways that we can send consistent messages through the school environment for being active, being healthy, and helping to give kids more minutes of movement? But we also know that staff wellness is a part of that, as well as family community engagement. And so when we talk about comprehensive school physical activity, that's exactly what it is. We want schools to increase quality PE, as well as increase physical activity opportunities. Every school in the state of Kentucky is identifying evidence of how they're doing that process. We didn't pass a big state policy, we didn't get a legislation, but we at least have consistency of a framework in which we want schools to start moving and engaging. Obviously, there's a lot more we can do at the state level to continue to build in supports to this, but right now it really has helped us to foster that conversation around a common sense answer. And we do see a lot of school districts having a lot of success around that comprehensive school physical activity approach. So that brings us to this. Let's move back to school. They heard of Let's Move? Let's Move in Schools last February became Let's Move Active Schools. The big picture Let's Move has obviously been a First Lady's initiative. It's been a Let's Move a lot of different things, right? Let's move communities, let's move churches, let's move schools, let's move childcare. It really has been a great awareness campaign that's very multifaceted. Let's get kids more active and let's get them eating better. Opposites of Let's Move. But there's obviously some stigmatism when you talk about a First Lady's initiative, and you've got politics and different things that play out. So last year, Let's Move in Schools became Let's Move Active Schools. That's very important because instead of being with the White House now, that blue circle there in the middle is the President's Council for Sports. President's Council for Fitness and Sports has been in existence since the 1950s. Think about school experience and you remember fitness testing. Presidential fitness testing comes from the President's Council on Fitness and Sports. Have we done fitness testing through every presidential administration? Absolutely. So Let's Move Active Schools moved into the President's Council, and so that is one entity. But there's also other managing partners. The logo to the left of the blue circle, that's the Alliance, which is now S.H.A.P.E America. The logo to the right is the Alliance for a Healthier Generation. 2 national partners signed on as managing partners for Let's Move Active Schools. All Let's Move Active Schools is equipping schools to do that right there. That's all it is. Saying, local control's in your hands, here's funding, here's resources, here's a common approach. So, to help us in Kentucky, just so happened, a school enrolls in Let's Move Active Schools, guess what framework they're doing? That's for a Healthier Generation. It's the exact same framework. In fact, if a school is already a Healthy Schools program, they simply click transfer, and all their information goes right into Let's Move Active Schools. So for us in Kentucky that have already been partnered with the Alliance, that's a great, easy next step. We're not asking schools to do something else. The old system was, do this for this grant, do this for this grant, do this for this grant. And a lot of people say, I don't have time to do all this. All of a sudden, on the national level, you have a consolidation of programs. You have a framework. You have an umbrella. And that's where Let's Move Active School is. And so then that's where the other partners come in. Nike, Partnership for Good America, Gen Youth, Childhood 180, Fuel Up to Play 60. You have all these national groups coming together to say, if you're a Let's Move Active Schools, then you're a priority school. More grants, more funding for technical assistance. That's been huge for all of them. Because once again, did we put something else on schools' plates? Absolutely not. They're already working with it. And so we've had a lot of success with Let's Move Active Schools. Jefferson County at our December 5th summit that Vic's going to talk about in a second, they became the largest district in the nation to fully enroll every school in Let's Move Active Schools. Up until December, only DC public schools had made that commitment. Jefferson County made that commitment because why? I had a simple conversation with them and said, look how this program aligns to program review. In all my years, I will tell you, my years of working in state government, Jefferson County is we're as bad as the Department of Education. I mean, there's so many different layers of approvals and conversations, and I've never had a more simple conversation with Jefferson County. In fact, when I talked about alignment to program review and S.H.A.P.E and different things, within 30 minutes I got an email back and said, yes, we'll do this. That's how simple and how quickly the conversation was about how closely this aligns to what they're already held accountable for. They quickly saw this isn't something else on our plate. This is going to significantly help us with what's already there. And so then you have technical assistance and different things. And that's really kind of what it looks like as far as kind of connecting back into our original message, is knowing that we got to provide youth with these elementary to middle to high from this comprehensive approach. And that's really why it's about being a physical lifestyle over a lifespan. If we can start to do that, then we can start to deal with those things below the surface. Now we're not dealing with cancer and diabetes and other things. Now we're reducing the incidence of those because there's more active lifestyles that are built in and consistent messages from the time they enter preschool or Head Start or whatever program they are until they exit 12th grade. It's a more well-rounded approach to the messages they've heard and the things they've engaged in. Here's the last one on this. I'll turn it back over to Vicki. Here's the other key part. Here's the key part for training for this. Here's a simple analogy. Nike has trainings that are sponsoring for Let's Move Active Schools. Goal is to get 50,000 schools enrolled. Bigger goal is to get 20,000 schools engaged with a physical activity leader. Now, important acronym on there, PAL. So when I talk to you about going into a school, how many of you go to a school and can find a librarian now? Why don't you find librarians now in schools? They're still there, they're just not, they don't go by that name necessarily.
Media specialist.
Media specialist. The basic gist of that is they had to evolve beyond the four walls of the library. What their school needed was an expert that went beyond the Dewey Decimal System. They needed to be that media, that technology, that connection to every single classroom in that building. And so you don't hear of librarians anymore. Some still go by that title, but holistically it's a media specialist. Their job has evolved. That's kind of our call to the profession for physical education. You have to evolve beyond the four walls of your gym. That's what you exist for. Most likely your school is going to keep you cut no matter how great your program is. They can't afford to invest in that because they got all these economic pressures and different things going on. But if you can be that PAL, that physical activity leader, that's engaging your kids in PE, but also become that expert for teachers in classroom physical activity, engaging in staff, if you can be what the media specialist in school for physical activity, then that's a program schools can continue to do. So that's what Nike is working with Let's Move Back to School to do around the PAL framework. And that's what we're working and rolling out our first trainings with that. So we're really excited. There was a program, Nike funded 23 national trainers back in October. That was the first group of trainers in the nation. Kentucky has 4 of those 23 trainers that live right here in Kentucky. 2 in the UK, 1 lives in Louisville, and myself. And so we're well positioned to go out directly. We're one of 4 departments of education that can give that training directly to schools the day after they call them. And so we really have a way to really move this forward. We had Shelley Foll come in February to our health subcommittee and recognize districts that have engaged and enrolled. Southern Obesity Summit, we're going to do a similar type of event. So your schools and districts know that there's a bigger opportunity coming to engage in that as we move forward. I'm done.
Between the two of us, you can tell who's the chatty one, who's kind of role reversal here. It's not so much the email. Yeah, you've been no. I wasn't in front to go forward. So you
That's the reason
got.
I stood in front of you.
So a lot of what we talked about today, we culminated on December 5th with a summit. We have several folks in here that were present at that event. That was something that occurred between both administrations, talking between health as well as our Board of Education. We're going to say that over and over together. We all work together, play nice together. And what we did here is the focus was bringing together teams, health and education teams, for school wellness. With that, you can kind of see the criteria. Folks had to work. I know folks in the room could talk about this. They developed a school team. We required 2 administrators, 1 health and 1 education administrator. What happens is you may go to a conference, you may go to an event, but if you don't have that administrative support or buy-in, it may not happen. It may not move forward. We made that as 2 requirements. We did something called the WellSat. WellSat will basically measure the school district wellness policy in terms of not only its strength, but its comprehensiveness. The folks had to do homework before they came. And then while they were at the event, we engaged folks in a lot of different new styled media, if you would. And I'll speak to that in just a second, but we had over 350 not making this kind of too focused. A lot of folks were interested in what MCO invested from a school advantage, a lot of our other organizations. So we had things running. We had Dr. Charles Bash, the executive summary we passed out, who came down from New York for us to be our keynote. Very exciting. We had 8 unbridled talkers. And with that, I want to point out that in the audience here, we have one of our unbridled talkers. Merritt, if you would please raise your hand and let folks know. We did this new system, new format, she can tell you about it, where you got on stage and you delivered within 10 to 12 minutes the passion about that particular component, what it was about. Got it in, got it out, we moved on. You all can go to our website here. This is great. I'm excited about this, to have all of this that we have on a government website. I tried to make it a little fancy. I tried to put little buttons on there. I tried to put different colors on there. They X'd all that out. But they still let us have all the PowerPoints, all the podcasts. So those are available for you all. So if you all want to use those, you can give the 8 areas. You haven't had enough of Jamie today. Jamie was our PE and PA TED Talker. You can in action again for
That'd have been more than 12 minutes. too.
He was. And of course, you get to hear him in the audience. He tells me, "Now, Vic, I'm not going to do this. You just quit, doing." So anyway, he went a little bit longer, but still very good. He did a good job. And so we have all that available to folks. So we encourage you to go there as well as use those podcasts for any type of event you would like.
That's not a very user-friendly URL there, but if you use the hashtag KYCSH, Google it. Even if you're not on Twitter, you can Google the hashtag and find the conversation, and you can find a direct link to that. So all that's out there.
Right, we're going to just real briefly kind of connect all this. Look about Kentucky Health now. You guys have heard about it. The governor, the school strategies. One thing we haven't heard us talk a lot about is tobacco-free schools. That was an emphasis in prior grants, not an emphasis this time period in terms of our grants, but we still work closely with a collaborative. So one of the measures is going to be how many school districts have a 100% tobacco policy. You can see we have 32 out of 173. Heard a lot about this S.H.A.P.E. Want more data? We can break it down between elementary, middle, and high school. We can kind of give that to you, but this is how we're going to be measuring those things and work out these in terms of S.H.A.P.E. as well as coordinated school health council, program, as well as BMI collection that is occurring at the state level through Infinite Care. They will have data available for us in June for our baseline measure, and we'll see how that information looks.
Vicki, back up.
Yep.
They're going to let you do that now. They've fought it for a while.
Okay, it is on the school physical is the BMI, and within that, then the school has to student, and from there is where we will be able to education and data at a district level. So two things have to happen. One is the doctor needs to put information on and data.
I know. I mean, we went through that whole conversation a bunch of times, and people didn't want to give it up.
Okay.
I don't know what changed their mind then.
What
It's
changed your mind, education?
the health subcommittee. It came to our health subcommittee. When that bill, that conversation I shared with how we got S.H.A.P.E into place is because we had this conversation around collecting BMI. And so when we said there's elevated childhood obesity while they want the data, and so Dr. Holliday did champion that and made sure, and that so the other thing that's not listed here is in program review. I talk about wellness policy implementation. In order for a district to get distinguished, they have to use BMI data to inform their policy. And so that's creating a lot of conversations too because it's in the school accountability piece. Dr. Holliday has been very vocal and supportive of that. When he and I sat down and Vicki with the lieutenant governor the other day, this issue came up again. So the capacity is there. Now we got to work with to improve the processes.
How are they going to use that, or will that become public?
The only way it'll be used is aggregate data. And so,
I realize that, but district data or a school data? I only got one middle school.
yeah, but because it's an IC, we know that we can collect it on the physical forms. But at the same time, there's other health departments that have been partnering that have been collecting that data previously anyway that go beyond just kindergarten and sixth grade. So so that's what we're kind of looking at now is knowing how much data is in the system and working to improve that. We will be working to collect that as a best practice. Working probably with Franklin County, it looks like, because we just had a meeting with them last week. And so KDE's been really, really vocal and supportive about identifying districts that are doing best practices. And they want to, so in other words, if Davies County is doing something great in RTI, they want to collect that, capture it, reproduce it, and put it out there and say, here's how they, and so that's what we're going to be doing with BMI data. Here's how the local health department is working with the local school district. And here's how they use that data to inform their wellness policy. And so hopefully within the next year or 6 months, we'll have some of that published for other districts to replicate and done that process. portal called Open House, and so we will report statewide data. District one would be down at the law. I mean, I don't have the conversations that happen.
Okay.
It's not going to, there'll be some bumps. I mean, there will be, but that's the reason we want to capture some that are doing it well, so that they can see how to use it and how to protect it, and put it by those things that we have. This school year was the first full year we've had percentile.
And the last is let's go back to school. As you with the governor's initiative. That, okay. At the end here, we appreciate you all being here today. We're sorry that Jamie talks too much. We didn't get to activity. But we understand and we appreciate your all's time, and we don't want to go over. All have any questions? Afterwards, we will be here for a little bit.
We're really fortunate we had 6 counties represented today, so that's great to have our presentation.
Oh, no, that's sort of the
Dawn, you
background.
got something?
Sorry, I didn't know you were doing that. We were,
I was going to give you the floor.
no. Go
I
ahead.
also passed out a flyer with information about what the Green River Regional Health Council is and what we do. And on the back, I have listed some more information. And also at the bottom, is the information for all the local health coalitions. In our Green River region, if you're not familiar, we have local health coalitions that meet in each county. And are local volunteers, citizens that are working towards improving the health of their county. And we all get together every other month as a region, report out, and we also do special topics and work towards the community health needs assessment. Have any questions about that? Please feel free to. But thank you all so much for coming. Enjoy your day.